It's a pleasure to be here today to talk with you about protecting Georgia's children. And really what we're going to do today is have a discussion about protecting Georgia's most vulnerable children. I want to talk with you about a couple of initiatives that we have, and then what we'll do is within DHS, and then what we'll do is we'll transition to the child welfare side. I think it's so important that I have an opportunity to really talk to you about DHS as a whole, and then from there we can transition, and I'll turn it over to Dr. Hill, who will talk about the child welfare side. So this is the presentation that we have before you, or the slides that I have before you. As we go through these particular slides, these are the same slides that I presented to the leadership team, my leadership team, to other stakeholders. And it's about providing the vision of DHS and what we're trying to do within DHS. So when I came home in July of last year, came back home, I was in child support for 5 years, a child support director for 5 years. Went over to GVRA for a short period of time, about 9 months, did a stint over there, and then got called back home. When I came back home, one of the first things I wanted to do was to change the image of the organization internally and externally for our stakeholders. One of the things about our agency that most people see us as a handout agency or an entitlement agency. And so we wanted to change that image from an entitlement agency or a handout agency to one that is about 4 things: self-sufficiency, safety of children and adults, independence, and of course work. And that was one of the key things that was missing, was work. So as we talk with staff, as we talk with our internal and external stakeholders, one of the things that we want to get across is that we're not an agency about handing out things or an entitlement agency. Even though we have benefit programs for Medicaid, TANF, food stamps, and child care, we are about helping people get on their feet and leveling the playing field for our citizens, especially for our children and especially for our adults. So I'm going to talk with you just a couple of things that we have ongoing within the agency and the IES, or the integrated eligibility system. One of the first things that I was hit with when I came on board was the integrated eligibility system. And that is a business re-engineering process that we were engaged upon. The department had started about 3 years ago in re-engineering its business model for eligibility system. That's for food stamps, Medicaid, child care, and food stamps, Medicaid, child care, and I can't recall the other. Intent, that's right. Intent, thank you so much. So as we was going through that business model, as I came on, we were near the end of re-engineering the process for over 1,500 workers. Could you imagine 1,500 workers over a three-year period trying to transform the eligibility process? And as we went through that, we had some hiccups and some bumps. And as you know, we have some issues with our consolidated call center. We're dealing, I see some nods in the audience, we're dealing with that feverishly as we go through this particular process. But one of the things that we wanted to do was stabilize our platform, stabilize the call center so that our customers would have access to our eligibility systems via the internet or via the internet. So we have done a tremendous job over the last couple of months of stabilizing that. We have more workers who are on the phones who are manning those calls. The work aspect, attacking fraud, waste, and abuse. One of the things that we wanted to do in our eligibility system is we have had a significant increase in the number of individuals who are receiving food stamps. Currently, we have over almost 1 million people in our state, that are receiving food stamps. That's an incredible number of people who are receiving food stamps. We have 10 million people in our state, but almost 1 million people that are receiving food stamps. One of the things that I want to do, and as a military person, as kind of a conservative person as well, is look at how can we help individuals who are receiving food stamps get on their feet, become self-sufficient, level the playing field for themselves. So one of the things that we had done in the state of Georgia, we had elected to go out of or to opt out of the work requirements for food stamps. So one of the first things I wanted to do was look at how can we help those individuals who have no dependents, who are not working or underemployed, how can we help them get back in the workforce? So one of the things that we have asked the feds permission to do is to enter into the work requirements or the able-bodied program. And so starting next month, we will be entering into the work requirements for food stamp individuals that have no dependents. So that's about 86,000 people in 13 counties or 13 areas across the state. So we'll be doing a pilot in about 13 areas across the state on the able-bodied program. So we're really looking forward to that. Our goal on the food stamp, on eligibility, is to proliferate food stamps for those individuals who are elderly. So we're concerned about leveling the playing field for our adults, those able-bodied individuals, and help them get into the workforce. But we're also concerned about our elderly population who have food insecurity, who don't have access to nutritional foods. And so we're trying to level the playing field in that regard. This one is near and dear to my heart, is the expansion or the self-sufficiency, independence, and accountability. One of the things when I was in child support and had to deal with non-custodial parents as well as custodial parents and their children, one of the initiatives we had was having a problem-solving court. And that problem-solving court was an alternative to incarceration for individuals who were non-compliant with their child support cases. So our goal at the time was to have one in every judicial court, which would be 49 judicial courts in the state of Georgia, superior courts. To date, we have 16 problem-solving courts in the state. About a third of the state, we have problem-solving courts for our non-custodial parents. And it is actually a transformation. It helps the non-custodial parent transform their lives, as well as the custodial parent, transform their lives to be able to support their children. One of the things that was very interesting for me when we first introduced the first problem-solving court 4 years ago was Justice Leah Sears came out and she talked about, she said, this is great what you're doing in helping the non-custodial parent provide for that child, as well as the custodial parent. This is great that you transform, but what are you doing on the front end? What are you doing on the front end? And she posed that question, what are you doing on the front end? And so she asked a question to the group and she said, I want you all to think about this. And she said, what will give a person a 90% chance of staying out of poverty? What will give a person a 90% chance of staying out of poverty? So it was a rhetorical question, but we were all standing there, to include Judge Simpson from Carrollton, Georgia. We were standing there and we were looking at her and we were just, scratching our head trying to figure out what are the 3 steps? What are those things that will keep a person from 90%, giving a person 90% chance of staying out of poverty? And so the first thing that came to my mind was, what's education? And so I couldn't figure out the second one, couldn't figure out the third one. She said, let me tell you what those 3 things are. And she said those 3 things are, first, 1, a person graduating from high school. Number 2, a person waiting until they're at least 21 to get married. And number 3, having their first child after they're married. So you might ask the question, so how does this relate to the children and protecting children? Well, it relates to the adults that are having children. And so one of the things that we can do as a state is to get the message out that you have a 90% chance of staying out of poverty. And as we all know, poverty and those kind of conditions breed factors that put our children at risk. And I saw that in child support, and I see that now even as the commissioner of the Department of Human Services. So as we go out, one of the things that I preach and try to talk with my staff about is how do we communicate that to our customers, and how do we communicate that to our citizens across the state about those 3 principles. The other thing that I am highly excited about is our faith-based and ministerial alliance. One of the first things that when I came in and I sat down in the seat, which has been the most humbling experience in my life, was when I sat in the seat and I realized that it was no way in the world, nor did I have enough resources to take care of all of the vulnerable children and all of the vulnerable adults in the state as a state agency. It was no way in the world. And so I realized that I had to rely on my faith, my personal faith, And I also had to rely on other individuals in the community, such as yourself. And so one of the things that we want to do is, how do we reach out to the community, and how do we engage the community, and how do we energize the community that we need you? There's no way that Dr. Hill, okay, there's no way that Dr. Hill, my staff, myself, or anybody else can totally serve the vulnerable children, the vulnerable adults that we have in our state. So one of the things that we started and we're looking at expanding is a ministerial alliance. And one of the things that we want to do is we want to reach out to faith-based organizations, we want to reach out to nonprofit organizations and leverage resources. We want to also educate our nonprofits and our faith-based community about the things that we know about, the patterns and trends across the state, as well as the resources that we have at our fingertips. And so we are taking a very aggressive and proactive approach in trying to get information out to our stakeholders, our external stakeholders. So, to continue on with developing and strengthening collaborations that provide self-sufficiency and independence is one bullet here that I want to talk about today. And one of the things that really hit home, before I came on board, I had an opportunity to go over to one of the graduations or one of the ceremonies that were held for the foster kids around the state. And that would happen in June. It was over at the Rialto Center. And I got invited over, and I saw all these kids that were bused from as far as Valdosta, as far as my hometown, Albany, Georgia, as far north as Ringo, as far east as Augusta, as far west as Columbus. And I saw all these buses coming in with kids who had graduated. They were all foster kids who had graduated from high school, and then some of them had graduated from college who were on the program. And one of the things that I asked was, how many kids, what is our graduation rate for our foster kids? One of the little notes that I want to pass on to you, we have about 7,500 to 8,000 foster kids in our care, custody, and oversight. 7,500 kids in our care, custody, and oversight. 7,500 kids, over 7,500 kids. But we have a graduation rate of 47% for our foster kids. 47% for our foster kids, when the state, I think, is roughly about 65, maybe 70% graduation rate. And oh, by the way, that 47% is for kids who have repeated a grade. And then it gets even worse when you think about the graduation rates for those individuals who have graduated without repeating a grade. We're talking about upward to 20% of our foster kids. Now, one of the things that Dr. Hill impressed upon me was that these foster kids, these kids that are in our care, custody, and oversight, those are our kids. Those are our babies. That means that their parent, for some reason or another, has said, I can't deal with that kid, or I can't provide for that kid, or I don't want the kid. And now the state has responsibility for the care, custody, and oversight of that kid. One of the things that we can do better on as a state and as an agency is providing educational and job opportunities for our foster kids. Because you got to remember, these kids were taken out of custody or taken away from their parents, or the parents didn't want them. And their playing field has already been unleveled. And what we want to do as a state and as an agency is to level the playing field for our foster kids, so they have the same opportunities as my kids have, coming from a two-parent home. Kenny A. How many of you know about Kenny A? All right, those of you who don't know about Kenny A was a consent decree that was levied against the state almost 8 years ago. And it was for maltreatment. Dr. Hill, chime in if I'm speaking wrong. It was about maltreatment of children in our care, custody, and oversight. And so the consent decree, there were 32 outcomes in the consent decree, the agreement that the state had with Children's Rights Incorporated out of New York. And those 32 outcomes, the state had to meet those 32 outcomes. So Kenny A consent decree encompasses the whole state. However, there are two counties that are focused, that the consent decree focuses on: DeKalb County and Fulton County. Again, we have been in that consent decree for 8 years. And some people say, well, why in the heck aren't y'all out of that consent decree? That's a long time to be in the consent decree. And oh, by the way, paying almost over $1 million a year to these organizations, to monitors, and paying to the Children's Rights Organization. Well, there are 32 outcomes that you have to achieve. 32 outcomes that have to be achieved. And they have to be achieved 18 months consecutively. 18 months consecutively. And some of those outcomes are out of our control. But one of the things that when I came on board, and Dr. Hill and I, we said, we will vow that we will get out of Kenny A. We will get out of Kenny A within the next 2 years. And we're going to do everything in our power to get out of Kenny A, that consent decree. And what that consent decree requires us to do is to pass all of those 32. And one of the things that we've said is we want to be a substantial compliance to getting out of Kenny A. And that means that controlling the things that we can control, that are within our control, passing those particular outcomes. And those outcomes that we can't control, such as the education or graduation rate for some of the kids that are in our care, custody, and oversight, some of those that we really can't control totally, we're going to have our attorneys go back to court. But some of the things that we're looking at doing in this Kenny A and exiting Kenny A consent decree is, one, we had to address the culture of our organization. And Dr. Hill has done a spectacular job of addressing the culture within our organization, of holding people accountable and making sure that our staff are accountable. They have a tremendous job that they do on a daily basis. But we also need to make sure that they have the data and that they are held accountable for doing the things that they're supposed to do. Number two, one of the things that we realize is that we need mentorship. And so we're leveraging outside resources, outside of Fulton and DeKalb, to bring in those experts who are around the state, who can come in and help our staff and mentor our staff. And then we had some infusion of new blood. We shook up some things in those two counties to ensure that we had the right leadership in place. And then we added a child welfare expert to the team. We had a team that had been in place for a number of years, but we added a child welfare expert because we didn't have one on the team at the time. And then we're sustaining accountability within Kenny A. I think one of the things that we have done, and one of the things that Dr. Hill and I talked about, I talked briefly about the eligibility call center. But one of the things that we have talked about, and one of the things that we initiated, is a 24/7 child protective services intake system. And so no longer will a person who has a report call the local office, because what we found is that the inconsistencies, if you call a local office and you talk with the caseworker, or there were inconsistencies across the state as far as procedure and policy. And so one of the things that we said we were going to do is implement a 24/7 centralized intake system. And we're about halfway complete with the rollout of the centralized intake system. Our goal is by the end of the state fiscal year is to have a 24/7 operational intake system where a person can call, no matter where you are in the state, you can call and talk with an expert who can take the information, and then provide that information down to the local office who can then do the investigation on the case. It reduces the amounts of screen outs that we have. It reduces the amount of inconsistencies we have in policy and procedures across the state. So we are extremely excited about some of the things that we're doing to try to help our most vulnerable children and try to do our very best. But before I turn over to Dr. Hill, I can't reemphasize, I can't reiterate how important it is for us to partner with the community. There's no way in the world that we can do this alone. And we need your help. We need your ideas. And Dr. Hill's going to talk about some of the things that we're doing with partners, with the private sector, as well as the public sector, to help us better our situation in the state of Georgia. So at this time, I'm turning over to Dr. Gill.
Try and make sure everybody can hear everybody.
And I am from Mississippi, and I do have an outdoor voice. So I think loud. Good morning. It is such a pleasure to be here to share with you all what we're doing at Georgia Division of Family and Children's Services to meet our vision of stronger families for a stronger Georgia. And as I look at the mission of Voices for Georgia's Children, we certainly share in that, and that we are here to make life better for children. And I am always saying to my staff that that's at the forefront of everything that we do. As a result of the intervention from Division of Family and Children's Services, the life of a child should be better than what we found. So I really make every effort, as the commissioner said too, in terms of the our children model, that these are our children. Every child that I encounter, I see as my child. And that's what we push on to our staff, that we want to make life better for them. I could probably talk about 8 hours on some of the things that we're doing at DFACS, but I was told I have about 10 minutes. So in that 10 minutes, I'm going to focus on some of the strategies and action plans that we have developed that specifically addresses the safety of children. I am sure most of you have followed some of the cases in the news, the child death cases. And so from those and some additional analyses that we were already involved in, we have developed what we think is a really strong, rigorous action plan to improve our practice around safety of children, and particularly improving the decision-making of our staff. So here, first we're going to talk about training, that we are partnering with several entities to really improve the skills of our staff. Because as I assess what we're doing and what we've been doing, I found that the training that we offer via DFACS, our education and training section, what we are preparing our staff for is really what our policies are, how to interpret our policies. And we do talk about the information that you need to gain from children and families. However, what has been really highlighted for me through some of the child death staffings and serious injury staffings and review of cases is that our staff needed training from experts on really how do you interview children to get the best information possible from them. Because what we know, and I know from having been a child welfare worker in various capacities, is that most often children are not going to give you exactly the information that you're trying to get. Regardless of the kinds of abuse that a child is suffering, they most often are still attempting to protect their parents. So we should not and will not be expecting that a child is going to automatically disclose to us that I'm not being treated well here. However, we know that Children's Advocacy Centers of Georgia, this is something that they really specialize in, how to interview children. So we're partnering with them, and they are working with us right now to develop a training curriculum that's really tailored to child welfare staff. And that training, they have indicated to us, will probably be a 3 to 4 day training with our staff to go over how to interview children. And so we will be doing that and we're slated to begin that in February. And all of our case managers that's responsible for doing investigations and what we call family support cases will be involved in that intensive training. And in addition to that, they are working on a more abbreviated training, probably a day or a day and a half training for the remainder of our staff. So we will be continuing to do this each year with them as we have new staff come on, that they train our staff and working on developing a kind of a certification program for them. Each year in Georgia, we conduct about 35,000 investigations of families. We generally receive about 70,000 reports of abuse or neglect each year. And within that 70,000 reports, we're talking about an average of about 160, 170,000 children that's being reported to us each year. And we investigate, again, about 35,000 of them. In addition to investigating, we have another option. If, based on the information we receive, it does not appear that the child is unsafe in the home, we're providing what we call family support services. Family support services, again, first off is the issue of safety. Is this child currently safe in this situation? And if we deem that to be the case, family support is about going out and assessing the family and really determining what services are needed to ensure that the family is functioning in a way that the child's needs are met. And again, we do, and we've been doing about 33 to 36,000 of those since we started family support April of 2012. And also, you know, when a report comes in, there are some that we screen out. In Georgia, we screen out about 15%, 15 to 18% of the reports that we receive. And those screen outs are really to be situations that do not involve the safety of children, or it's not related to abuse and neglect. And I would say that the number one kind of cases or reports that we're screening out generally have to do with custody issues. You know, when we receive calls from one parent that said, you know, the court has given them weekly visitations and they're not getting it. We get quite a few of those calls. We also get calls, you know, regarding individuals who are over the age of 18 or individuals who are in another state. What we have started to do also in the last couple of months is to really go back and review the screen outs that we received in the past year, because we want to ensure that the best decision was made about whether or not to screen that case out. And as the commissioner mentioned, we're moving to a centralized child protective services system in the state. Currently, 8 out of 15 regions are already on a centralized platform, so that when the call comes in, the individual that responds to the call can be located anywhere in Georgia. And the reasoning behind that, first of all, is that we want uniformity in the way that we operate, so that what is considered to be abuse or neglect in Fulton County is also going to be considered abuse or neglect in Chatham County. And we have 159 counties, and when counties are doing different things, then you're going to, when they have that option to, then that means that around the state, different things will be happening. So we want to ensure that the response is the same. Also, with the centralized intake system, it allows us the opportunity to actually monitor those calls real time. So we have supervisory staff and quality assurance staff whose job it will be to be listening in on calls as they take place. Now, for me, that was really exciting. You know, and just thinking about technology and keeping up with technology, that's something that, you know, had been almost unheard of, to think that you could listen in on the calls. What happens now is that, you know, we have the word of what the intake worker tells us, and then we're hearing from the reporter saying, this is what I said. But through this system, we can certainly monitor, you know, those calls, and if there is a need to intervene in the call or shortly after the call, we can do so. So with that, you we're looking at really training to our intake workers on how to get the best information from staff. And so again, under intensive training, we're also partnering with Georgia Public Safety and Training, or just GIPSTIC, to also do 3 to 4 day training. They're developing a curriculum, again, that's tailored for our staff on how to interview adults. Because again, there are some nuances that we would be missing, that they're certainly in a position to say, these are the kinds of clarifying questions, or if you're trying to get at this, this is the line of questioning that you should be asking. Because I think in child welfare, probably over the past few years, we've kind of gone back and forth between, do we go with more of that real social working response as we're dealing with families? Do we need to do more of an investigatory kind of response? Then we come back to more of the child welfare, the social work kind. So what we really want to do is somewhere in the middle to blend that. Because what we know to be true is that there are some families that we do need to take a much more investigatory, deep drilling down in order to ensure that the families are safe. And that's what we're going to be partnering with GIPSTIC to assist us with. So that's kind of it for the intensive training that we have coming up. We work very closely with GBI, and we will continue to do so with them. We consult with them on cases. They do various trainings around the state with our staff also. A second thing that we're doing is creating what we call internal safety panels. And the purpose of these internal safety panels is really, again, for me, it's to break up what can become county groupthink. So that when a case comes into us, normally, the county receives a case, and within that county, the case manager, supervisor, that administrator determine what the next step should be for that case. As we have reviewed cases, and prior to this position, I had been the Director of Federal Regulations and Data. Part of that was a quality management or case review system. That counties start to have a particular mode of thinking. And what we want to do with the internal safety panels is that on some cases, while that case is still open and we're actively investigating it, we will have panels of subject matter experts from other areas to also take a look at that county, those cases, and to ask certain particular questions so that we can be sure that the decisions that we're making are really good ones and that we've really thought them through. And I have 3 minutes. So we're doing the internal safety panels on the active cases. We've also developed an external review team that we're working with a couple of individuals, primarily individuals that have been child advocates and former judges, to review some of our processes and to make recommendations and assist us in developing strategies for improving our practices. We are continuing with and expanding medical consultation on cases. We work very closely with Children's Healthcare of Atlanta. We contact them and they do trainings for us. We're also moving into Georgia telehealth so that we can have some of the virtual capabilities to consult with physicians around the state. I talked about reviewing previous screen-out decisions. We're also doing a lot more leadership training. And with our staff, providing them with, Commissioner Horton mentioned, mentors. Right now, we started this kind of a pilot in Fulton County, but throughout the state, we want to provide our supervisors in particular with over-the-shoulder support so that as they're working cases, making decisions, we want seasoned, experienced people that we know to be subject matter experts to really be working with them to assist them in understanding how do you staff a case with your case managers. When there are issues, how do you even work with the judges on various things? So we're working on that. We're also heightening our focus on community engagement and accountability. After my several appearances on TV. I received a number of calls from various people, from ministers who were praying for me, and ministers who wanted to get involved in our work, as well as several sheriffs from around the state, and other individuals that said, you know, we have the same goal. We all want the same thing. How can we work better to achieve that? So we're doing much greater collaborations on that. And the last thing that I want to mention is that we're also focused around youth who are aging out of care or transitioning from care, older youth. So as you look at this part from Voices for Georgia's Children, in their overview, we borrowed this as you know, our vision for older youth in care and youth who are aging out of care. That for them, we want to ensure that they're safe, healthy, educated, employable, and connected before they leave us. And so we have a lot of work around that, including a 2-day training that will be coming up in March that we call Teens Are For Me. Because we really want our staff and the community at large to embrace our teenagers and to assist them in moving into adulthood. So I have about 7 hours and 45 minutes for material, but I'll stop now. And again, thank you so much.